10 more people in England have died after testing positive for the coronavirus, the largest total in a single day since the outbreak began. Could mass gatherings of more than 500 people be banned across the UK? New legislation is being considered.
The decision's been taken in some countries because of the impact on public services and because when you have a mass gathering that draws on the police and the ambulance service who need to support it.
The government insists it's not a U-turn and that all decisions are based on the best possible medical advice. Good evening. 10 more people in England have died after testing positive for the coronavirus, the largest total in a single day since the outbreak began. In all, 21 people in the UK have now lost their lives. And the number of confirmed cases has risen to 1,140, though the true figure may be much higher. The Chief Medical Officer for England, Professor Whately, says the government's action plan aims to save lives and protect the most vulnerable. He also says every single person has a role to play in beating the virus. Here's our health correspondent, Sophie Hutchinson.
Yep. On your marks, get set, go!
A large group of runners out today, keeping fit. But the question now is for how much longer? Concerns about the coronavirus mean the government may ban mass gatherings. It's understood the measure could be brought in as early as next week in order to free up emergency services to deal with the virus.
The evidence tells us that stopping mass gatherings doesn't have a huge impact on the spread of the virus. But, for example, the decision's been taken in some countries because of the impact on public services and because when you have a mass gathering that draws on the police and the ambulance service who need to support it.
Today, the death toll in the UK jumped, almost doubling from 11 to 21 people. Nearly all of those who lost their lives were in the at-risk groups, aged over 60 with underlying conditions. But it's emerged that one was not. There are now more than 1,100 confirmed cases in the UK. One of them is a newborn baby and its mother. But officials believe the true figure could be as many as 10,000. The World Health Organization has raised serious concerns about the UK's strategy to allow enough people to be infected with the virus who then recover in order to build up so-called herd immunity. Meanwhile, hundreds of scientists have written to the government urging them to introduce tougher measures to stop the virus spreading and warning of the risks of a lack of action. And other experts agree.
The UK government response has, in my view, placed the country at a considerably higher risk of becoming the next domino to fall in the series of outbreaks that we've seen around the world. Just remember this. If you cut your number of contacts in half, then you have cut in half the number of opportunities the virus has to transmit. If everybody were to do that, then there would be a chance of slowing the infection to an extent that you would not be overwhelming the NHS.
You know the national anthem, please sing it.
The government has announced it's developing plans for more new ventilators to be produced as quickly as possible and said the NHS will buy up beds in private hospitals to boost capacity. It's insisted its approach is the best way to keep the public safe and stressed those with a dry cough and a fever should self-isolate.
And Sophie, you've got news of more possible measures the government may introduce.
Well, yes, we've been hearing this evening from scientific advisors to the government. They say the Scientific Advisory Group for Emergencies has reviewed the latest data and said, as it expected, the epidemic is now progressing to such an extent that it is recommending new measures be brought in. These are described as shielding the vulnerable and household isolation. Now, in terms of shielding the vulnerable, they are people who are elderly and have underlying health conditions. Quite what the shielding looks like, we don't know, but it may well be just reducing that exposure to other people to a minimum. So, for example, having shopping delivered, if you like, but it may involve other things as well, about staying at home. Household isolation is all about whole families perhaps being isolated at home, even if only one person is unwell, in order to reduce down infection rates. So we are expecting that the government would follow the recommendations from its scientific advisors. It's said all along that that's what it's doing. And this goes some way towards some of the measures that many scientists are clamouring for and say are necessary to protect the public.
OK, Sophie, thank you. Sophie Hutchinson there.